Hello everyone, I'm Dr. Zanyar and welcome to this video. What if I told you that smoking, one of the deadliest habits on earth, appears to protect against certain diseases? Sounds impossible? Yes. After all, smoking is linked to cancer, heart diseases, COPD, stroke, and millions of deaths every year. Yet researchers have repeatedly found something strange. For a handful of medical conditions, smokers seem less likely to develop the disease or experience milder symptoms. Before you throw away your common sense and light a cigarette, there is a catch. These findings do not mean smoking is healthy. Let's explore the surprising science. One is Parkinson's disease. One of the most consistent findings in medical research involves Parkinson's disease. Study after study has shown that smokers are significantly less likely to develop Parkinson's compared to non-smokers. Scientists believe nicotine may stimulate dopamine-related pathways in your brain and provide some protection to nerve cells involved in movement control. But there is the problem. Even if smoking lowers Parkinson's risk, it dramatically increases the risk of cancer, heart attack, and lung diseases. It's like protecting one room of your house by setting the rest of it on fire. Number 2 is ulcerative colitis. Ulcerative colitis is a chronic inflammatory disease affecting the colon. Strangely, smokers are less likely to develop this condition than people who never smoke. Researchers suspect nicotine may influence immune responses and inflammation in the gut. In some cases, people who quit smoking have even experienced flare-ups of ulcerative colitis afterward. But doctors still do not recommend smoking as a treatment because the overall health risks are enormous. Number 3, endometrial cancer. Some studies have found a lower risk of endometrial cancer among smokers. Scientists think smoking may alter estrogen levels, which could partially explain the reduced risk. However, smoking increases the risk of many other cancers: lung, throat, bladder, kidney, and pancreatic cancers. So any potential benefit is completely overshadowed by the damage. Number 4, preeclampsia. Preeclampsia is a dangerous pregnancy complication characterized by high blood pressure. Several studies have observed lower rates among smokers. Researchers are still investigating the biological mechanisms behind this unexpected relationship. But this is one of the clearest examples of why correlations does not equal recommendation. Smoking during pregnancy increases the risk of miscarriage, premature birth, low birth weight, and many other serious complications. Number 5, some neurodegenerative disorders. Researchers have explored possible protective effects of nicotine against certain neurodegenerative conditions. The theory is that nicotine interacts with receptors in brain involved in memory and nerve signaling. This has led scientists to investigate nicotine-based medications and therapies. Notice the important distinction. Scientists are interested in nicotine itself, not the thousands of toxic chemicals found in cigarette smoke. Why this happens? So there are several possible explanations. First, nicotine affects the brain, immune system, and inflammatory processes. Second, smoking may alter hormone levels. Third, some findings may be influenced by hidden factors that researchers are still trying to understand. Scientists doesn't always produce simple answers. Sometimes harmful things can have isolated biological effects that appear beneficial in specific situations. This is the most important part of this video. No major health organization recommends smoking to prevent any disease. Not one. Even in conditions where smoking appears protective, the overall harm vastly outweighs any potential benefits. Smoking remains one of the leading preventable causes of death worldwide. That's why researchers focus on understanding the mechanism involved, hoping to develop safer treatments without deadly side effects of smoking. So yes, there are diseases that appear less common among smokers, but that doesn't make smoking healthy. In fact, these strange findings remind us that science is often more complicated than headlines suggest. The real goal isn't promote smoking, it's to understand the biology behind these surprising effects and use the knowledge to create better treatments in future. If you enjoyed this surprising medical mystery, subscribe for more science facts that challenge common assumptions.